Good afternoon. I'm Charles Jennings, and I'd like to welcome you to this event of the Christian Regenhard Center for Emergency Response Studies. Today's event is really a special one for us because it features a speaker who has a long history of association with the center, and I'm happy to say my association even predates the center's founding. When we do our talks here at the center, we try to get people an idea of what's going to be important in the future. And we try to orient first responder audiences to issues that are emerging and that will prepare them to deal with new challenges. And I think today's speaker certainly befits that in so many ways. And I'll give a very short introduction to Len in terms of the orthodox one, which is that Len Garris is fire chief in the city of Surrey, British Columbia, which is the largest city in British Columbia that no one's ever heard of. But it's adjacent to Vancouver and actually extends all the way down to the U.S. border. And the city is undergoing tremendous growth and will continue to grow to the point where I think at some point in the future they're still forecasting that it will be larger than Vancouver, larger than Portland, Oregon, and larger than Seattle. So, it's a formidable city now. It's approaching 500,000 people. And so Len is fire chief there. He's been chief there since 2001. He was there prior to that as a assistant chief. In the time he's been there, he's developed an affiliation with the University of the Fraser Valley and their Department of Criminal Justice. And he has an affiliation with a research center there, the Center for Public Safety Research. And that's the formal introduction. Let me give you the informal introduction. Was that I first met Len at a conference in, I think it was 2000, in San Diego. And it was a small group, and so we just happened to, encounter each other at the social hour. And I think I was having a beer, and Len was having a beer, and we just started talking. And here was this guy who was interested in a fire service professional who was unhappy with the status quo and had a lot of great ideas and was doing some very innovative work at that time around looking at the effectiveness of sprinkler systems. And so since 2000, Len and I have stayed together as friends, and we've worked in various capacities as academic collaborators, as a consultant, and done a number of projects around issues on high-rise fire safety, deployment analysis, and so on. But over this time, Len has really had a very pioneering effort to implement evidence-based practice from a fire service background. And Len is one of the first, I think only the second fire service organization that I'm aware of in North America who has a PhD on their staff. And actually PhDs are quite affordable when compared to fire salaries. And so it's not an inconceivable thing to do, but he actually did it. And they've done, basically over the last 6 or 7 years, basically developed a research network between the Surrey Fire Service and the University of the Fraser Valley and a number of collaborators. And that research partnership has been very productive. And in fact, they're probably, as a group, the most prolific group of authors doing peer-reviewed scholarly work in the fire service policy domain, period, in North America. And so it's really quite an achievement. And so Len is very forward-thinking. He's relentless in the way he attacks a problem. And so while maintaining his position as fire chief, he's had a relentless focus on problem solving, on performance measurement, evidence-based practice, and looking beyond the traditional narrow confines of the fire service to aggressively go after community problems. And so I'm very pleased to introduce and welcome Len Garris here to John Jay to talk to us about evidence-based practice and some of the many interesting things he's been involved in and continues to be involved in. And And his books are over here, for those of you who didn't see them. So Len, welcome.
Thank you.
Okay.
Thank you. So I have to buy him dinner tonight for that introduction. And thank you very much. And this title here, The Right Decision, Evidence-Based Decision-Making for Police and Fire Professionals, was an unintended consequence of a question that I was approached by the Canadian Centre for Security Sciences. Is an offshoot of the Canadian Defence Department, who's, after 9/11, generated some, a think tank group and some funding for, developed some concerns about being prepared for the safety of our nation, and injected quite a bit of money, about $40 million a year, for research, and a lot of it was going towards policing, and they wanted to direct it, as it matured, into sort of a smaller organizations, and they developed communities of practice, COPs we called them. And community of practice, there's 13 communities in Canada that vie for funding to do certain projects. And I chair the Canadian Community of Practice for Fire Services for Canadian firefighters across Canada. And it's a research group, and from that came a grant that originally designed and developed and wrote evidence-based decision-making for fire professionals. And that genesis, that book, was done in a very short period of time, or manual, and a workbook that goes with it. And then shortly after that, the Research Foundation for the Canadian Chiefs of Police approached us and said, can you do one for us? We see this as being very important to the foundation of police officers in Canada. And we've had some great success with that. And then just last month, we were commissioned by the Canadian City Managers Association to write one or to reposition it for government workers, because they saw it as being a good piece. So we're really excited about, so it's really unintended, right? So we just thought we would do this little project, and it's turning into a big thing. So we're really proud of this, and we're very proud to be able to bring this to John Jay, and hopefully you'll find it useful for your work. So that's what this talk is about, is to kind of paraphrase the pieces of that book and to insert some examples and some metaphors that we've been able to achieve in our own organization, both on the fire and the police side. And I do teach a graduate program at it's an arts program for criminal justice leadership and at the University of Fraser Valley. And what that program is designed to do is to take officers that are developing into their master's degree in arts, and we teach them leadership and how to take something here and actually put it into practice over here. And I have some examples about that in this presentation on how long that might take and how difficult all of these good ideas are to actually, in academia, where we develop these things, and actually put them into practice. So I'll talk a bit about that. So effective decision-making in a changing world of public safety, and we keep saying it's been changing for almost 20 years. We keep telling everybody it's changing, and it will continue to change. But certainly increasing complexity in our world, decreasing number of fires, crime rates are plummeting right around the world. Increasing range of calls, training demands is getting more and more difficult. Procedurally, we had a very unfortunate scenario that occurred in our Parliament buildings in Ottawa, where an officer was shot and killed, or a military person who was guarding. And that, within 1 month, we have a program in our city with the Royal Canadian Mounted Police, and we have a lot of auxiliary members that assist them in crowd control, and they go to events. And they used to be able to have a ratio of about 10 auxiliaries to 1 police officer. But now the armed rate of civilian versus police officers 1 to 1. So all of a sudden, all of those auxiliaries became useless for us. So all of a sudden, things change so fast, right? So we have to be aware of those things. Training demands, equipment needs, and of course, public scrutiny. The public are not always our friends. So public scrutiny, and that's where the public gets involved, is a transparent decision-making model in terms of strategic planning, socio-economic costing equals evidence-based decision-making. So there really needs to be the overarching strategy. The policies in Surrey, our council operate like cabinet ministers. I'm able to do an awful lot of things that a lot of my colleagues are not. but in the opposite can be true in some other areas. So why is evidence important? Policies and programs that are not guided by sound evidence can cost too much, they can waste resources, and they can yield poor or unknown results. And an awful lot of the things that we do are dated, or maybe they need to be validated. And I'll give you an example. And I'll use this for an old city like Chicago. And this occurred about 15 or 20 years ago. And there was a fire at 2 o'clock in the morning, and actually a police patrol unit was going down the street. The streets were dark, and it was very late at night, in the middle of the night. Not very much was moving, and he glanced through the corner of his eye, a small flicker down an alleyway. And basically what he saw was that flames were coming out of a container where they had dumped the garbage the day before, and it was starting on fire. You could see the smoke, you could see the flames. And he alerted the fire department immediately. In a very short period of time, the fire department arrives, but you can see the flames are progressing, of course, right, out of this container. And it's right adjacent to a large window, and it starts to crackle. And this occupancy that it's adjacent to is a garment factory. And he knows that, the flames get inside that garment factory, it's going to be one major fire. And the first engine company shows up, and they stop right in front of the alley, and the first young fellow that gets off the truck spots up the alley. You can see the flames, it's not very far, and he estimates that the length of hose that's on the side of the truck, he'll be able to reach it very quickly. So he grabs the hose very quickly, and he flakes that out, and he runs up there, and he yells, "Water!" And the engine operator charges the hose line, and the water comes out, and he extinguishes the fire just as the glass is starting to crackle and fall away from the framework. So it's just in the nick of time. He's very proud. Turns around, and he sees a bunch of people standing like this up at the end of the roadway, quite a ways away. And he thinks he's going to just he's going to get an award for this. So as he's walking back, and he starts to hear this mumbling, and all of a sudden another vehicle shows up, and a battalion chief with his white helmet gets off, and he looks around and he says, "What happened here?" He says, "Well," he says, "truck stopped. I saw this opportunity. Flames were coming out of the container. I grabbed the hose, I ran down there, opened up the nozzle and put it out." And he says, "Really?" He says, "Where is the ladder?" He said, "What ladder?" He said, "Where is the ladder?" He said, "The ladder's on the truck." He said, "But our policy says the first engine company on the scene must ladder the building. And it's not laddered. Why not? And you're the first guy to step on the ground. Why wasn't it laddered? That's our policy. It's rule number 7. Why didn't you follow rule number 7? Well, I saw this opportunity. I knew the flames were going to go inside. This is a garment factory. It could have burned down." He said, "Son, you're suspended. You didn't follow the rules." Right? Sound familiar? So anyway, this poor fellow goes through this arbitration case to keep his job. That's how serious it was. He didn't follow the rules. And so during the arbitration, they said, "Well, what's the purpose of this policy in the ladder? Why is it there?" It's a law, it's a rule. It's rule number 7. We've had it for 150 years. Where did it come from? So they brought in a historian, and they started cross-examining him. And he said, "Where did this rule come from?" And he said, "Well, I'll tell you where this rule came from. It's very simple." He said, in the early days, the insurance companies would hire fire brigades to put out the fires. And the first fire brigade that got there, they would put out the fire. But you know what happened? It was such a lucrative business that fire brigades were popping up all over the place. And we started to get into arguments on who was going to get paid, who actually got there first, who put the fire out, and how that worked out. So we developed the rule. The fire department that arrives first ladders the building, right? And the one that has a ladder on the building gets paid. That's where the rule came from. This was 15 years ago. So, some of the things that we do today are not genuine for today. We need to change those. So what this is all about is we need to look at the things we do, make sure they're evidenced, make sure they're working for us, and they actually have value today, because there's an awful lot of stuff that we don't do. Why is evidence and base important? External decision makers who approve department budgets may not view department requests as justified if they lack clear and compelling evidence. More and more our bosses are saying, "Show me what it's going to deliver. Give it to me. Tell me what it's going to do. Well, how is it going to benefit society? How is it going to benefit the organization?" And we're hearing that more and more. So policies that are evidenced often produce better results and can increase credibility and support in the department as a whole. Navigating the world of evidence means really constructing and defining what the problem is, evaluating evidence, thinking critically, contextualizing the evidence, explaining the value, environmental scans, SWOT analysis, articulating evidence, and making decisions. And that's kind of the nutshell. So increasing governmental fiscal pressures during the 80s have really incited us to be thinking differently, or some of us anyways. Some of us have been able to get away with what we do because we're so big and monolithic that it's like trying to stop the earth from turning. So some of the increasing efforts started in research in the clinical practice areas and back in the 70s, actually. And if I take Cook County, I look for an example in the medical field, and if I take Cook County during the 90s, I mean, Cook County was the first blood bank that occurred in kind of the world. That's where they developed cobalt beam therapy for cancer treatment. That's where they were the first group that attached 4 fingers that were severed, right? It had never been done before. So it's a great, it's a place, they treated more gunshot wounds than probably most of the wars, right? And they developed some of those techniques. And they learned to diagnose chest pains, and it was Goldman, a guy by the name of Dr. Goldman, his rule. And this is where the ER series was inspired. So if I set the stage in 1998, Brendan Riley was given the prestigious position to be the CAO of Cook County Hospital. And the hospital was a mess in those days. He trained homeless people to do simple lab tests. That's how bad it was. There was 250 ER visits a year going on. People were stacked up in the hallways. Like, you probably saw the shows. And it was just amazing, and that was true. It was just overrun with people and capacity. They had 30 heart attack cases, chest pain cases, that were coming in the door daily. And why was this important? Well, he only had 12 intensive care beds, so that meant that some people were dying of a heart attack in the hallways, stacked underneath of people and over top of people. And he had to figure out a way to triage that. So Riley turned to Lee Goldman. And Lee Goldman in the 70s, he actually did a lot of work, mathematical and analytics, to determine what chest pains were all about. As you can see, he defined 3 things. They had to have angina, fluid in the lungs, systolic BP had to be below 100, and that was a good indicator of doing it. But how did Goldman figure this out? Well, in the 70s, he was hired by the U.S. Navy to actually do a lot of tests to predict what heart attacks were. What were those 3 things? And the reason it was important is because when there's a guy down in the bottom of the sea in a submarine, in those close confinements, they all had anxiety, every last one of them, every day. But some of them were actually the onset of heart attacks, and they had to know the difference because they're in this battlefield sort of ocean environment. And if they had to surface that submarine and actually deal with the guy's real emergency, they had to know what it was. So they spent tens of thousands, if not millions of dollars, figuring out mathematically how that was going to occur. So what happened? Years passed with little support. Riley was really frustrated because he couldn't get his doctors to adopt Goldman's rule. So what he did is he lined up all of his ER doctors and he said, listen, we're going to do this for 1 month. And if you don't do it, I'm going to fire you all. And he couldn't afford to fire them all. But he said, you know what, you're going to do this. And they did, and guess what happened? The rule won 70%. Was 70% better. 79 to 85% of the predictions went to 95. Rules changed. Lives were saved. Now, do the quick math. How long did that take? 1970, you developed that. 1998. This is in the medical world. And one of us might have been in that hospital waiting to have our heart attack diagnosed. And yet all of this information exists. So this evidence movement is going to take a long time to socialize. And these tools about building it into the baseline of what we do is going to be important. And whatever we do, as long as we do something so that we can get some rationale. So leaders and evidence-based decision-making challenges. Administrators often feel pressure to make decisions quickly with incomplete or outdated information. Most people rely on personal experience or gut instinct. They just arrive at that decision without even going through the mechanics of it. Poorly made decisions often increase conflict and morale. Understanding evidence, the basic fundamental things. Is this quantitative or is this qualitative? And what is the difference between the two? And what are we talking about? Have you ever read Edward de Bono's Six Thinking Hats? And what he talks about is the colors, the different colors of conversations. So if I'm having a conversation with Mrs. Reaganhart, and if she's saying, I don't agree with that, she's got her black hat on. And if I'm saying, well, I think it's a great idea, I got my green hat on. And you know what? The two colors are never going to match. But if I start focusing on why it won't work, and we agree on the things that don't work, and then if I could move her to the green hat and say, well, here's some things that might work. That's what the difference is, right? Is understanding the different pieces of information, whether it's you can prove it or whether it's a conversation. So defining the problem, what is the issue and how do we want to problemize it? How do we identify options and alternatives? How can we think creatively to generate new ideas? And how do we generate the alternatives? So generating new ideas and alternatives, it's pretty simple. Talk to people outside your normal circles. Engage groups in brainstorming. You know what they say about firefighters when they're sitting around a coffee table? The more they talk to each other, the more they believe each other. That's how it works. So reading journals and books, surfing the web. If you were to go to cgrufe.ca, you will find those publications on there. They're free. You can download them. There's a workbook that goes with both of those books that you can download. Focusing on your clients and customers. Are we here for us, or are we here for providing a better place for our citizens? Reputable consultants, environmental scans and SWOT analysis. Developing a strategic plan, making sure what you're doing fits into the statement or organizational values of the organization you're working with, because you're not going to be successful if you're not. A statement of goals and objectives, outlining how to achieve the goals, and an indication on how to measure success. Organizational purpose, short-term, mid-term, long-term organizational values, representation of core beliefs. Organizational goals are broader the targets for which one is aiming. Objectives are midstream steps to achieve one's goals. So in my business, I came up a number of years ago with a problem statement, and I was looking to reduce the number of residential fires and fatalities and injuries in our community, increasing units capacities and handling a broader range of services. I'm in a community that has 1,000 new people moving into it every month, and that's been happening for the last 10 years. And if you don't think things change fast, they are changing at light speed. And we have a massive social issue with our property values flipping over. In other words, the improved value of the buildings that are on the land are no longer viable, so nobody's investing in them, and they're waiting for those opportunities to redevelop. So we're creating slums, and we're having difficulty. And what's happening is those homes are turning into grow-ops, which British Columbia is famous for, and they're also turning into recovery homes and those types of things. So we're having difficulty managing that, and so we have to figure out how to do that. So we had to come up with organizational goals and objectives. To achieve this, we started developing a list of objectives, and one might be to conduct research into best practices. So our first problem statement was we did a 20-year analysis, and we knew, and this will become apparent a little bit later on, but the number of residential fires that we actually attended that had a working smoke alarm was increasing, but the number that worked was decreasing, which means that people didn't have a chance to get out. So we undertook a 20-year review. We realized that 75% of the work that we do are residential properties. We have commercial properties that we inspect on an annual basis, so we were able to look after those. And only 30% of the fires that we went to had a working smoke alarm. And we knew that international best practices like the United Kingdom, who adopted policy changes in 2000, had great results. They've gone from nearly 1,000 residential deaths per annum in a population of 65 million people to under 300 in 10 years. And we were really keen on how they did that. What did you do? And the focus was home-safe visits and working smoke alarms. It was really a simple formula, maybe too simple that we didn't want to follow it. So when we looked across British Columbia, in Alberta, BC, and Ontario, we analyzed 50,000 residential fires. In Alberta, only on the left-hand side, only 19% of the structure fires that went to Albertans had a working smoke alarm, 30% in British Columbia, and 43.4% in Ontario. But in Ontario, we thought they have a massive enforcement program. If they show up to a fire in your house and the smoke alarm doesn't work, you're getting a ticket for $1,000 right on the spot. So they have a little bit better rate. So why is this important? Well, in British Columbia, 6.5 people, the rate of deaths is 6.5 per 1,000 fires in terms of our death rates. And if the smoke alarm is working, it's 1.4. It's 78% spread. So your chances are 78% better if your smoke alarm works when you show up at a residential fire of surviving. So when you all go home tonight, right, you're going to test your smoke alarms, right? So what did we do? Well, we took those best practices. We looked at the Center for Disease Control in Atlanta, Georgia, and they profiled who those victims were. And those victims are high proportionate elderly citizens over 64. They're young children under 6, disadvantaged, unemployed, single-parent families, and highly residential mobile people moving from place to place, and combined with hotspots of fire incidences. In the city of Surrey, that's only 40,000 locations. So what did we do? We went out and we knocked on those doors. That criteria that I just mentioned to you is the non-random criteria of the populations that are most likely to have a fire, to be injured or die in that fire in our city. And we use census data, and we looked for that criteria, we mapped it, and we put that overlay, which you see there, and we said, those are the people that are most likely to have a fire. Those are the people that we're going to go and visit. So what happened? Well, something did happen that we didn't expect, is the number of residential fires that were occurring in the city dropped by 42%. All the time while we had a 21% increase in the number of dwellings that were occurring. So that's a pretty interesting set of data. As you can see where the trajectories were and where our treatment took place. So we actually published this study. It's peer-reviewed. It's in the Fire Safety Journal. You can have a look for it. But we didn't anticipate that the actual number of fires were going to decline. So we started theorizing, and we have an individual here that could maybe help me with the sociology of that. But all of a sudden, those are fires that somebody wouldn't have been paying attention to, right? That suddenly are alerted in time to actually intervene, take care of the fire themselves in a very small aspect, a kitchen fire, something like that. Put it out themselves, and it's a fire that we never went to. But you know, the interesting thing is the number of injuries started to go up. So now they're intervening sooner. Instead of dying in the fire, they're intervening sooner, and we're starting to see a few more injuries that are occurring. So it's a bit of a trade-off, but at least they're alive, right? So death and injury rates in the city of Surrey dropped by 35.2%. All the while, we had a 23.5% increase in population. So those are the things that we have in our control and we've actually been achieving. We're pretty happy with that. So you know what? We said, geez, if public education and educating people while we do our company inspections, while we inspect public buildings, if we actually tell them how to comply, tell them what we're expecting, tell them how to keep their businesses safe, what would happen? So we adopted the same thing. Every time that we have contact with a public building official that's managing that building, when we're doing our inspections, our safety inspections, we actually hand them a piece of paper and say, by the way, this is how you need to comply. Thank you. So this is what we found in our studies in the city of Surrey, that non-compliant properties that are more likely to catch fire if they're non-compliant, and the rate is 4.7% higher. So all of a sudden, we've got a good linkage and a reason why we should be doing this inspection. So what happened? Structure fires went down, vehicle fires are going down, residential fires, commercial fires, industrial fires, assembly fires, and it's just not an accident. If we look at the 22 municipalities around the Metro Vancouver area, Metro Vancouver, the population of British Columbia is about 4.6 million people. Metro Vancouver is made up of 22 communities in the condensed area. It's about 2.5 million people, and the city of Surrey is about 500,000, right? So we're about a quarter. Well, the individuals around us The rates are continuing to go up by 48.4%. Surrey's going down by 13.9 in that cohort with a 62.7% spread. So it's not an accident. Something's definitely going on in our region in terms of residential fires as opposed to what's going on around us. So what happened? As I mentioned to you before, 30% in 2008, number of working smoke alarms, that went to 54% last year, the residential fires that we went to that had a working smoke alarm. And I just wanted to repeat this. The death rate is 6.5% if the smoke alarm doesn't work for 1,000 fires, 1.4 if it's working. So what's happening in BC? Well, we started focusing on food banks, all the places where vulnerable people go, and started conducting analytics on how well their smoke alarms were working, asked them to go home, incented them, gave free smoke alarms out, made sure that they were safe, and in the province of British Columbia, our death rates are plummeting. I won't be happy until we've eliminated that. So, measuring outcomes. So when we adopt these policies, we have to ask ourselves, how are we going to keep them going? If I go back to the original slide when you saw the rate of working smoke alarms, you'll see a period in about 1993 that it suddenly went up, shot up. And that was those sort of get out alive campaigns that the province would run, and we'd all rally around it. We'd talk to people, and we'd see the rates go up, and then we would get busy and go on to something else. And that's what our problem is. So, what did we do? Well, there's the 38,240 inspections that I went to and home visits of the most vulnerable. I did a pre-rate and a post-rate, and I had 13 cohorts that we visited over a 3-year period. And all of those stations went out with a list of vulnerable properties and actually conducted a treatment to those. And as you can see, since 2008 or 2009 when we started this program, 2008, the pre-rates and the post-rates are still maintaining. But you'll notice in cohort number 12 and 13, the rate has actually changed. So what happens is every one of those homes that we visited, we actually put the purpose of that visit into our database, into our records management system, and we recorded the fact that we visited that house and we treated them. And we treated them one of two ways. We either gave them a piece of information and talked about home safe, tested their smoke alarm, or if they weren't available, we left them with a package and a letter from myself saying, hey, this service is available. And we documented that. So every time one of those cohorts has a fire or has an event or a call for service that's fire related, it goes into the system, and we know whether or not it was visited or not, and when and how and what took place. And those are the pre and post rates that are taking place, and that's how we're monitoring this in our system. And so we continually know on a daily basis what's happening. That's how we sustain it. And this is hall station number 5, which is highlighted in green in the top, and it looks at its cohort rates. And if you boil it down, the cohorts that have actually changed their behavior, where the rates are actually different and a little bit alarming, but changes, we only have 2 cohorts, one made up of 190 visits and the other one of 1,129 that we need to visit where the rates have changed, that we actually need to go and visit and analyze and say, what happened in these groups? Why are the behaviors changing? Sorry? It might be, but you know, the social demography, I won't know that because of privacy issues. I won't know who was there and who wasn't there. But I'll know that the location, the actual home, was visited and something happened there. And depending on the area, you probably could be exactly right. We have quite a large proliferation of secondary suites that are occurring in our community. And that's where we get this high mobility, right? And that could be the case, but until I drill into it, I won't know. But it is a small, for managing 40,000 visits and then being able to narrow it down to like 1,250 or whatever, and say that that's part of the problem that's reemerged. I don't have to retreat the whole thing again. And you know, the literature that I looked at initially went that this treatment should only last about 4 years, the behavioral changes with these types of visits. That's what the initial research said. Some of it's lasting about 6 years, so I'm pinching myself that it's still working well. Does that?
Yeah, no, since you're talking, I just wanted to ask.
Sure. So now I'm talking about police services, and I'm just I'm not a criminologist by any stretch, but I do teach a course in criminology in terms of change in leadership. And here's some of the things that I would be looking at if I was a criminologist in terms of understanding what goes on. I'd be looking at the number of property offenses and the unit's capacity in order to do things. To achieve crime reduction goals and operational efficiency, we start with a plan of, for example, pretty much like I did with fire services, and conducting research and best practices. And this is the region that I talked about of the 22 municipalities that I could get data for. And we start out with our crime rates. And of course, Langley City, we can see at 145 per capita, and the safest place is the city of Port Moody at 29.47. But the interesting thing is that we have this obsession with population to police officer ratios in British Columbia. And I would only ask the criminologists and the policymakers to say, is population to police officer a reflection of the crime rates? And if you can see kind of in the middle there, the medium of all of those, with a rate of about 800 police officers per population, and the crime rates vary quite a bit, and so do the activities. I think there's a lot more to do with just police officers and crime rates. I think the community, the demography, and a whole bunch of other things make up what's going on. So that was my sort of attempt to sort of draw some attention to. It's not a simple equation, and it's not a simple problem to be answering, or else we wouldn't have these, if it was, we wouldn't have these massive schools of criminology and criminal justice, and if it was such a simple question, or a simple answer to it. I did look at the number of court facilities in the various regions and say, is anything like that driving it? And once again, number of courts, number of Crown offices, and reports to Crown Council. Certainly the volume and the variety of different things that are occurring have rates on it. One of our biggest problems we find is mental health issues. We've defined crime rates and issues. There's a lot of people that are challenged. They say as many as 1 in 5 in our healthcare system require mental health support. And so looking at the facilities and the ability for us to support those as opposed to police officers is quite a bit different. The origins of the program, understanding the local problems. Some jurisdictions, such as Abbotsford, which is close to us, and Burnaby, they've dropped crime by 50% in a very short period of time. So it's clear that these sort of initiatives, when they focus on them, maybe it goes back to that leadership aspect of taking the best practices and actually putting them into place has a difference. So implementation of procedures, once again, sort of the mechanics of our book or our advice is putting procedures into place that meet desired outcomes. We need to really know what it is we're trying to achieve when we're going to do something new. This applies to all goals and objectives identified in our plans. There can be soft, there can be hard initiatives, such as reducing fatalities and injuries. Sometimes we're afraid to say that because we might not achieve it, right? So we sort of skate away from the obvious. That book that's in Mandarin over there, it's called Eliminating Crime. It was one of the 7 police-led principles of crime reduction. And there was 5 of us. I was the publisher, and had a number of criminologists who were the authors. And so we sat around the table and said, what are we going to call the book? And somebody says, Reducing Crime, Lowering Crime. I said, okay. So I said, now, we're talking about eliminating cancer. And 1 in 7 of us is going to get cancer. So are we happy to say we're going to reduce it, or are we happy to say we're going to eliminate it because one of us is going to die? So suddenly it changed. It said, so when you personalize it, all of a sudden it was eliminating. Let's kill it off entirely, right? Let's stop crime together. So it changes the context a little bit, and I think that was important. So thinking critically, that's very interesting. When I talk about logical fallacies, casual links, and linking evidence to explanations, that goes back to sitting around that police officer table or firefighter table, and the more they talk to each other, the more they believe each other. And so they'll say, well, that's what happened, right? I mean, this is what happened. This is why that happened. often that's not true at all, but it might be. So this was one that I had the privilege of being involved in just recently, and I gave evidence for the federal government. I did a study on why homegrown marijuana shouldn't be in homes and what the damages were, because we inspect those, we have a lot of evidence. And the morning I was about to give evidence to the federal court, and I was waiting there to be ushered into the court to give evidence, somebody showed me the local newspaper in the morning, and this is what it said: I have a cultural bias against marijuana because I'm going to be an expert witness, and this is what it was about. And this is what my bias is about. This is what medical marijuanas look like when you arrive there. And as you can see, they're extremely dangerous. But I have a bias, and so my facts were really good, I believe. But in fact, this is what they're saying about me because they can't dispute the facts. So, so we get these logical fallacies that appeals to authority, ad hominem arguments, red herrings, circular arguments. All of those things are important to understand when you get into the conversations of this stuff. And this guy follows me around on the internet if you happen to look it up. And this little guy, they attach him to my name, and but this is what this is all about, right? So we have to be, leadership is not easy in a sea of individuals that have characteristics that don't want you to change, right? And they don't want you to follow the norm. They don't want you to be different. So casual linkages like Hume's conditions, these sound really simple, but this goes back to these conversations among practitioners. Cause and effect must be coincidental. Cause must come before the effect, of course. And there's no underlying third factor resulting in the cause. In other words, like we're totally not on the same page. Thinking critically, linking evidence to explanations, we must find an explanation that's consistent with the evidence. We must then conduct secondary tests to make sure that those hold up, right? Let's make sure that we're strong in our, and we have to working through null hypothesis, of course. Collecting evidence through internet searches, Google, framing environmental scans. Example of reviewing changes in the United Kingdom and the fire services in the United Kingdom in the 2000s. They reformed stuff. They took everything that they knew and believed for hundreds of years before, and in 2 months they blew them up. All of those things that they thought about deployment and all those other things, they said, those are no more. We're changing everything. And they just did it. Centralized government so they could influence everything. There was a lot of good things that happened, a lot of bad things happened. But it changed some stuff, and a lot of the good things stuck. And so there's a good place to be looking for changes. SWOT analysis, we have to include these groups in our changes because they can stop us from what we're doing. We need to keep things simple and focused on the issues, be realistic about the strengths and weaknesses of the organization. Strengths and weaknesses, opportunities and threats in a SWOT analysis. Using statistics, a tool for decision making, measurement. We need to measure the things we do. The various different aspects of statistics. Descriptive statistics, measuring typicality, variability. Population estimates, understanding what random and non-random is. Equal chance, significant differences, predictions on what you're going to do. There's a lot of math can really help us make those kind of changes, right? Predictive analytics, we're using some of these tools in terms of, and what that means is obviously statistical techniques that help us analyze historical facts, what happened in the past, and picking out those things that will happen in the future, and making sure that and using Bayesian logic. We use an analytical tool in our business to predict when our fire truck goes out of the station, is there going to be a probability of another call occurring, and can we actually put something in its background? And it kind of looks like this. So if a structure fire occurs, that area, the red of the city in the station area, said that there's a probability a fire is going to occur, and there's an algorithm that runs in the background and automatically calculates the likelihood of another fire. And what it does is it says, if you make this move, this is what the coverage is going to look like automatically. And the business rule that we set in the city of Surrey is 25% of a chance of another fire occurring. If that's true, move it, and it's automatically running in the background. And our basic analysis of that year after year is 20% of the time that we move, we actually catch a call. So in other words, if we wouldn't have moved, the response times would have been longer, fires would have been bigger, things would have occurred that much longer. So, and we say we're in the business of being in the right place at the right time, as opposed to trying to be everywhere at once, which is a typical model of risk in our businesses, right? You won't take any risk. We just got to have things everywhere. So this software program is just emerging in Los Angeles, and actually there's two criminologists in the Simon Fraser University in British Columbia, their son, the Brantinghams, Jeffrey Brantingham's in LA County, and he's developed a software program called Predpol. And Predpol is a predictive analytics for policing. And using the past time and place, time of crime, unique algorithms, Predpol provides law enforcement agencies of where the next crime is going to occur during the daytime. Based on what happened yesterday, here's where you should be tomorrow if you want to prevent crime from occurring. Creates these 500 square feet boxes where police officers are asked to patrol if they have discretionary time, and this is what they do. So Los Angeles Police Department's Foothill Division saw a 20% drop in predicted crimes year after year, and on January the 13th of January 2014, and they experienced one day without crime. And they were like, that's kind of an amazing, when you think about it, right? You have crime every day, but all of a sudden they're celebrating one day without crime. So, in other words, that day, they happen to be in all of the right places that actually prevented those crimes, or at least they believe. So I'm just going to show you a little clip here.
Imagine a world where police know where crimes are going to happen before they happen.
This is 10800 right here.
We're in the box right now?
Yes.
We're riding with Los Angeles Sergeant Steve Gomez, who carries a map drawn up by LA's Predpol, or Predictive Policing Computer, with tiny red boxes where Predpol says crimes are most likely to take place in the next few hours.
The Predpol boxes are 500 feet by 500 feet, so we're talking about a very small area.
You heard right. Those boxes are just 500 feet square, but officers are told that's where they should make certain they patrol.
The box is saying, here's a location where the risk of crime today is greater than anywhere else out on the landscape.
And when you drive a black and white through a Predpol box, you can presume that you are likely seeing the bad guy, and the bad guy is likely seeing you.
This may sound a little like science fiction. In fact, like one movie in particular. 2002's Minority Report had police of the future using floating psychics who predicted murders before they happened. Predpol uses math to crunch crime data with an algorithm originally written to predict earthquakes.
You can spend 5 minutes here and have a better chance of disrupting crime than being anywhere else.
Dr. Jeff Branningham, one of Predpol's creators, says his system uses 10 years of crime data to make its predictions. And in its first 6-month test, LA police say they saw dramatic results.
We had a 25% decrease in burglary for that 6 months versus the same 6 months a year ago. And overall, we saw a 12% reduction in the targeted crimes.
Chicago is not a Predpol client, but the company's engineers ran 3 years of Chicago crime data through their computers as a test. And with boxes covering 10% of the city, they say they were able to predict fully half of the gun homicides which actually occurred.
It was some of the first data that we looked at from the point of view of gun crime.
We should note that Predpol is not necessarily about arrests. It's about preventing crime in the first place.
If we have zero crime area and zero arrests, that's great, because you have less victims.
It might seem impossible that what works for burglary in LA could work for murder in Chicago. But Predpol's creators say they believe it can work for murder, that putting a cop in the right place at the right time could be a lifesaver.
If you can just get past that moment of being disrespected and tempers can cool, that crime can go away forever.
Predpol's creators say they believe they help a department use existing resources more effectively. As we say, Chicago is not a Predpol client, but a police department spokesman said the city is using other predictive methods to try and determine who is most likely to be involved in violent crime, either as a victim or as an offender. Robin Allison. Imagine a world.
So So, a pretty interesting world that we're in, right, in terms of the science and the ability to operationalize it and start to focus on the non-random characteristics where we might be and what we might be able to do. So this kind of modeling is very interesting, and it's starting to become more and more predominant, and it's going to be leadership, courage that allows us to adopt that. Going back to talk about statistical modeling, how much of the variation of the outcome is explained in the model, which elements of the model are significant and are not. Of course, we're getting into the details of what's occurring. What is the relative impact of various components of the model in the outcome? Are those impacts large enough for a meaningful policy change? Probably in a lot of cases we can adjust deck chairs, but we're really talking about trying to change course in the way that we do things. And how much of the various components in the model interact with another? When we talked about costing, identifying the components that are component of which the question or an analytics relates to, setting out objectives that we intend to achieve, eliminating crime, eliminating deaths, identifying options or choices that are valuable, conducting financial and cost-benefit analysis. It shouldn't always be about cost, but cost is important because people ask about that, especially if we're choosing priorities against one program versus another, and who's going to deliver more for the same dollar, or what things do we have to actually cut away from what we're doing. So understanding the financial implications there is important. So cost-benefit analysis is define the problem, identify the constraints and limiting factors, list all the alternatives, list the benefits, how much are the costs and benefits quantified, using evidence and identifying and framing the question, gathering the evidence, organizing the evidence, review the decision-making process leads to the right decision, right? And that's online with our website at the University of the Fraser Valley, along with a workbook. That version will be online next week, along with a workbook. It's free. And I just want to leave you with this last video that we're quite proud of.
Surrey is the second largest city in the province. We have about 500,000 people. A third of our population is under the age of 19. We have a very diverse community as well. One of the things that our fire department is well known for, not only across the province, the country, but also internationally, is looking at different ways to be innovative, looking at different ways to ensure our community is safe.
About a decade ago, the Surrey Fire Service started conducting evidence-based research in order to find solutions to its problems. The reason we did this is we wanted to become more strategic in deploying our resources in the city. Through this research, we commissioned the University of the Fraser Valley to conduct a 20-year analysis of our fire problems in the city of Surrey. What we discovered was that these fires are non-random. We discovered that they come from certain places and neighborhoods in our community and certain individuals that lived in those neighborhoods.
We want to have a vibrant city. We want to make sure that our residents are safe and that we're on the cutting edge of implementing programs and technology, innovation. So all of those pieces really tie into the Home Safe program.
Once we identified what the trends were, we started looking abroad and in North America for best practices. What the best practices told us was that smoke alarm giveaways contained with fire education actually made a difference. So armed with this information, we developed a program called Home Safe. We started focusing on sending our crews door to door to deliver this information. Our Home Safe program targets these neighborhoods that are most at risk, and to date, we visited nearly 40,000 homes in the city of Surrey. and we've got fantastic results from that.
University of the Fraser Valley has been working with the Surrey Fire Service for several years now, conducting fire and public safety research. And this has produced the Home Safe program, which involved an analysis by both faculty and students of almost 5,000 fires in Surrey over a 20-year period. As a result, it gave the Surrey Fire Service a big picture perspective on what was happening in Surrey and where they needed to direct their resources. It shows that if cities want to make good decisions, they can rely on university research by both students and faculty to give them answers to real-world problems and allow them to make decisions based on facts, not just assumptions.
When the Surrey Firefighters Association was first approached about the Home Safe program, we saw it as a pretty unique approach to fire education. Typically, we set up a booth at a community fair and hand out brochures, but it's unsure on how effective that really is. Whereas the Home Safe program, the crews went out in the district, they went door to door, they had that personal touch with the community on delivering the importance of fire safety, and we really felt that that connection was important on getting the people aware of the advantages of fire safety. As firefighters, we see the devastation caused by fires firsthand. So for us to partner with the fire chief on a program that we knew could reduce fires and protect life and property in the city, it was important for us to be part of that.
When our fire hall receives a list of home safe addresses, we'll suspend training for 1 week and go visit those selected areas. If someone is home, we'll take the time to discuss how to prevent house fires and offer to inspect your smoke alarm. If you do not have a smoke alarm, we'll install one for free. If no one is home, we'll leave a fire prevention information packet at the door with an introductory letter from the fire chief, and it will invite you to call our fire inspection branch for a free fire inspection.
It has been very cost effective actually, because we use firefighters that are already on duty, and so that gives them an opportunity to connect with the community as well as their role and function as firefighters within the city of Surrey. And we make sure any of the hard costs are covered by either sponsorships, and in fact the Firefighters Union has gotten into the program as well in terms of helping fund some of the hard costs. The results have been significant because with the 40,000 homes that have been visited, we've seen significant decrease in fires, fire-related injuries, and death. And the data shows that decrease that has taken place because that's all monitored as part of the measurement of the program.
Every year in Canada, we still have on average about 600 Canadians that die from fire-related injuries. We're so proud at the Royal College of Physicians and Surgeons to be partnering with the Surrey Fire Service. We now have a proven program that can make a difference in trying to eliminate the 600 preventable deaths that occur each year as a result of fire. So any fire department out there across the country that's serious about reducing death within their community would take a look at this program and just replicate it and put it in place to reduce this needless death that we see every year as a result of injury.
I think the real value is multifaceted. When we look at the effectiveness of it, we look at the efficiency and cost aspect of it, but also that model can be replicated in any city, anywhere across the country.
Now to conclude my talk.
Surrey is the second largest.
Sure. Okay, sorry about that. Yes.
You said in your presentation that a certain percentage of fires with fire alarm was inoperable or
Yes.
not working. Now, was that due to either no battery or expired battery, or was it due to the device itself? I recently saw a show which said that fire, alarms, they have a certain shelf life, and so I was wondering, what was your experience?
It's all of those, every last one of those things you've mentioned. The battery was missing, they'd taken it down because it was annoying, It expired over time. It was in the wrong place. And what the great thing, the solution to that right now today is that technology has defeated just about everything that man can do to disable a smoke alarm. So in other words, it's a 10-year life battery. Put them on the ceiling, they're good for 10 years. When it doesn't work anymore, it tells you, goes into alarm, and it says, I'm no good anymore, please change me. And you can't take the battery out to use it for something else. And if you're cooking or you got it in the wrong place and it goes off, if you press the button, it will give you a 5-minute relaxation from the noise. It'll reset itself, and it goes back into service. And if you're a senior or somebody who's disabled, you can actually have a button or a key fob to press the button to put it in out of alarm for that 10 minutes or whatever that it needs to do. So we're in a great world, but the majority of the reason for not having a working smoke alarm is they start to expire after 10 years, and people don't realize that. They see it's on the ceiling, they believe it. I did another study of a random sample of a group of people. It's a SAIL group, which is Strategies and Actions for Independent Living. The average age of the group was 80 years old, and the first swath of analysis by the researchers found that all of the individuals, there was nearly 1,000, 500 of them lived in single-family dwellings, and nearly every one of them did not have a sense of testing that smoke alarm at any stage of the game. They just believed it was there, it worked. That's all they knew. And that's our problem. And that's one of the reasons why we saw a greater ability of smoke alarms being present and a reducing number that were actually working at the time of fire. That's the problem. So we need to change that. And the only way to change that is to convince the people that they need to change them. And the people that are most at risk, I can tell you with this formula, I could find every one of them in New York. And we could treat them. We could do that. And we would see massive changes. Because you know what? In a population of 65 million in the United Kingdom, they had exactly the same results. Except they went to every door, every day, for 10 years. There's another way to do it. It's using social demography for that. That's a long answer, I'm sorry. Well, we actually, the Royal Canadian Mounted Police, who are its largest detachment in Canada, which is in the city of Surrey, they have 850 members. And the Chief of Police and myself, we have a breakfast meeting once a month. We talk about common problems. And he had an emerging problem that was occurring in one of our neighborhoods, which is predominantly South Asian. And about part of our population are we have, out of 500,000 people, we have 90,000 South Asians that live in our community. And a very large concentration in our Newton area. And the prior year, this was in the spring, the prior year, he said that he was expecting to have what he called opportunity residential breakings and enterings is going to emerge again. And what opportunity means is that the South Asian community have a tendency when they go out not to secure the premises. And they get burglared because they're easy to burglar because they don't lock their homes. And he said, I think it's going to occur again, and I'm really worried about it. It's a big spike. So he said, I'm thinking about doing a door-to-door treatment, and I know that you're really good at doing that. You've geospatially figured out the formula. You can come up with it really quickly. I said, sure. He said, do you want to help me? And I said, well, not unless there's a message I can take, because I'm not going to do it for nothing. So I said, okay, so we have two things that we're going to deliver to the community, right? I said, yes. We're going to deliver residential break-ins, and we're going to deliver, turns out, cooking fires, because the South Asian community, a lot of them are new Canadians, not used to the stoves, that kind of stuff, and they have lots of kitchen fires. So we took two messages, and what we did is we blitzed 3,000 addresses in the concentration, the hotspot area, and we did that in 6 hours, and we brought a big fleet of people together. We did it in the evenings in May, just pre the summer. And a year later, we had a 67% decrease in residential breaking and enterings and a 20% decrease in kitchen fires using this educational treatment. So, you know, if we understand the problem and we understand the treatment, we know what works, and we actually go out and do it in a sort of non-random characteristic, we know there's a real problem there, and we measure it, those best practices can become very useful for us and tools in our toolbox. to change behaviors. And we've done that in a number of other areas in our community as well. Go ahead. Yeah, in a lot of cases, cost avoidance is a great thing to put. So the slides that I don't have is to look at the per capita rates in the city of Surrey and the staffing ratios in the same populations in Surrey in comparison, saying what does our infrastructure actually cost us, and what does it cost us to be everywhere all the time, every time. And I can say that if I compared the city of Surrey's costs on a holistic basis, that I could probably, if I was the same as Vancouver with greater fire rates than us, I'd be spending $25 million a year more on my staffing. I haven't had to face that because we're so dramatically different than others in terms of our costs. When I start hearing or watching the playing field across Canada, and I start seeing, like, for example, the city of Ottawa, when they settled their arbitrated collective agreement at 3.5% per year over the next 5 years, which is like quadruple the inflation rates and the rest of it. And I'm seeing that their stations are now starting to close. What they're doing is they're actually keeping their costs the same, but they're reducing their expenses considerably. And I think that trend is starting to see that more and more, especially I've seen it in the United States as well, where resources, policing, and public safety is being cut back. And they are becoming important, but it's not so important for me because I'm already there. And I'm fortunate to be there. And I'd love to show you a slide on what it costs us to do business because it's really impressive. And go ahead. To show up. It took us 3 years to do what we did, those 40,000, because we, as you say, as you noted with these predictive analytics, we know where our busy times are. We know all of those. We know what's going on. We know it retrospectively. And we schedule in between those times. So we're actually, we're predicting. We're using predictive analytics on everything we do. I can take down, collapse 5, 6 engine companies at a certain time of day. The software recalculates the demands and repositions everything. And I do my project or whatever I'm trying to do for whatever period of time. Because the software uses a term called ETB, estimated time back. So in other words, what's the estimated time that you're going to be available to resume your responsibilities? And I can open that window or close it wherever I want. And if I want a 6-hour window, I want to take those resources away. The software will calculate all of those rates during the hour blocks retrospectively, and it'll say, here's your best solution. And it does that. By and large, we have a great reputation, firefighters, as opposed to police officers. And most people let us in. But we also have a program, there's a program called Success. And it's for new immigrants that come into our community. And it's a settlement organization. And so we're getting, all of our new Canadians that land in Surrey, come to Surrey, they're multilingual, multi-ethnicity. And we make sure that, and we actually meet those people on day one, everyone that signs up to that program. And we introduce ourselves, we talk about fire safety education, we talk about who we are, what we're there for, and I think that helps a lot. But it's still not uncommon for an officer to be walking down the street to see the blinds closing and stuff as well, because they think there might be an immigration officer as opposed to a police officer, right? Exactly. So there is some of that does occur. But by and large, it's been quite successful. And the new immigration and the new Canadians really worry me a lot because of the different characteristics and the habits that they have. And we're trying to do our best. And we have not done a great job, but we have an outreach program, and we want to be reflective of, our organization wants to be reflective of the community. And so our ethnicity is, we recruit directly for that, and we recruit directly for females as well. We're going to the universities, going to the colleges, and we're marketing our program as best as we can. And it's very difficult because people don't want to be firefighters, right? And we have to change that. So, but we work hard at it.